Good afternoon. Today I will be talking about we'll be taking class on the first paper subject, that is psychosocial foundation of behavior. This is one of the unit you have to study, that is family factors influencing mental health and illness. So today I will be talking about how family factors are influencing the mental health. Okay. So we will be talking about the early deprivation and trauma, neglect and abuse, attachment, separation, inadequate parenting style. So I'll be more focusing on the early deprivation, and basically I will be talking about the attachment factor. Okay. So you know that how when a person get mental illness, we have to find out what are the contributing factors to make a person become mentally sick. So there are a lot many factors. Psychological factors, maybe the social factors, maybe the family factors, maybe the biochemical factors, maybe the. So today we are going to focus on the family factors. In family factors, I also already mentioned that I will be talking about the one factor. So family, we know that it's a unit. So basically family consists of father, mother and children. This is the concept of family. So when we have a family, the most important factor is connecting factor is the love and care. Basically it leads to attachment. We are attached to our father, we are attached to our mother, we are attached to our children. So that makes the family. So when there is a disturbance in the attachment, that will lead to the psychopathology. So today I will be more talking about the attachment. So researchers already have done a lot of research, the studies on how the attachment starts or how the attachment happens among the family members, especially the mother and children. All right. So I will be talking about the attachment theory. So from 1910 onwards, two theories were dominant in understanding a child tied to its mother. So there are two basic predominant researchers, area of psychoanalytic theories were there to understand what is how the attachment happens. So one is psychoanalytic theory and other one is social learning theory. So today I will be talking about the psychoanalytic theory. So these theories both emphasize that a relationship developed when the mother feeds the infant. So they're telling that both theories, both psychoanalytic and social learning theories, that attachment happens between a mother and infant basically or because the mother feeds the infant. So that leads to a pleasurable relationship when hunger is satisfied. So it's simple as such. The baby will be in distress when when baby feel hungry, and immediately the child will be crying, and then mother feeds, and once the hunger pangs are satisfied, the baby feels satisfied, and there comes the attachment with the mother. These theories were described as secondary drive dependency theories by Bowlby. So simple factor is that mother feeds child and infant, so that attachment happens. So said the secondary drive. So the primary drive is different, hunger, but secondary drive is the attachment. That is why it is called secondary drive dependency theories. Now, what is the secondary drive dependency theories of attachment? There are many theories are under this category. One is cupboard love theories, as they become known, therefore the dominant, because there are a lot of studies have been done initially. According to them, they say we attach to our mother because she feeds us. So the major people of this theories were Tollard and Miller and Freud. So they always say that they propagated or they made theories that we attach to our mother because she feeds us. So the primary drive is food, and that leads to a secondary drive for attachment. As I already said, the primary basic drive is food, but that leads to attachment. But then there are a lot many people said against, or found evidence against cupboard love theories. Bowlby noticed that evidence from animal studies challenged previously held notions. Bowlby felt that this is not correct. And Lawrence and other scientists noted that infant geese attached to parents who did not feed them. Therefore, imprinting seems to occur during a critical period due to exposure. So initial theory said that that feeding leads to attachment, but they also noticed that in other experiments that even if the mother is not feeding, the baby is still attached to the mother. So no matter whether baby is hungry or it is getting satisfaction or not, no matter, the baby is still attached to the mother. So they said there will be imprinting, there will be a critical period, there comes the imprinting, so that naturally they will be attached. Now the other observation, Harlow observed that at times of stress, monkeys preferred a more comfortable and cloth-covered mother figure to feed them rather than wire mesh mother. So this is another study they have been conducted. Evidence also grew to show that human infants become attached to people who did not feed them. So Bowlby noted that if secondary dive dependency theory was inadequate, what was the alternative? So these are the conclusion actually. So Bowlby, so initial observation was that okay, we developed the attachment to mother because mother feed us. But then there are a lot of other studies also found that, or other evidences showed that mother need not to feed the child, then also the attachment occurs. So then Bowlby naturally felt what is the next, or what is the reason for attachment. So there comes the attachment theory of Bowlby. Bowlby actually a British child psychiatrist, a part of psychoanalytic community, and when there are a lot of predominantly object relations theories were dominant, and later she had differences opinion with the psychodynamic concept, certain concept. So she worked from in a different way. So Bowlby's work evolved from observing the impact of World War II and working in a home for maladjusted boys. So the impact of separations, losses and disruptions in close relationship. So her work was basically during the World War, and of course in a war many people lose their family members, many deaths will happen. So she studied the children who lost their family ties, maybe due to separations, losses or disruptions. So the answer came when Bowlby considered the child's actual experience with its primary attachment figures. So he considered this to be the bedrock of psychic structure. So what are the actual experience of the children with their parental figure, especially mother? That is the actual building block or bedrock of the psychic structure. Bowlby developed an ethological theory which suggested that the infant attachment bond is an instinctively guided behavior system that has functioned throughout human evolution to protect the infant from danger. So basically it is instinctively made. It is not that it's not based on some terms and conditions. It is instinctively made the relationship, and it has to basic idea is to protect the infant from danger. With this evolutionary based theory, the fear of strangers and other threats to survival is innate. So they have concluded that that is why they are, when babies got exposure to strangers, they may feel fear, or any other circumstances they feel threat. So these are basic innate. It is nothing is learned. It is basic innate. So Bowlby considered that infants preferred a principal attachment figure for comfort and security that we call monotropy. This monotropy has gained a lot of support. Again, some researchers remain critical to that. Some writers reported that attached and unattached infants, Bowlby thought this would be that without attachment and we get affectionless psychopathy. So this is the criticism of this theory, because we cannot term the infants divide the infants like affectionate infants or attached infants and unattached infants, and attached infants will be very adjusted and healthy people, and unattached people are going to be to develop psychopathology. So this is one of the major criticism. And this is the basic aspect I just want to explore in this class. So in this class I was trying to say what is attachment and how the attachment develops, and we are talking all about the two, I already said two separate streams were the psychoanalytic and social theory models, and we were talking about the psychoanalytic aspect, only one theory, and I'll be going to the next theories in the next class. Thank you.